So your PBM, your pharmacy benefit manager, charged your health plan, let's say $800 for a drug last month. They paid the pharmacy, let's say $200. They kept the other $600 quietly, legally, and it's in your contract. This is called spread pricing. And today we're pulling it apart because if you're a self-funded employer and you've never heard this term, you are almost certainly paying it right now. Here's how the PBM model works structurally. So the PBM sits in the middle. They negotiate what they pay the pharmacy, and then they separately negotiate what they charge you. The spread between those two numbers is their profit. And in a traditional PBM contract, there's no requirement to disclose it, to pass it through, or to even acknowledge that it exists. Let's go back to our example. $800 billed to your plan, $200 goes to the pharmacy, $600 is kept by the PBM as margin. Now multiply that across your formulary, across your top 50 spend drugs, across a full plan year. That number gets really large really fast, and none of it shows up anywhere in your reporting. You can't audit it, you can't see it, you're just paying it. So we're hearing about this problem all the time. Even celebrities like Mark Cuban have stepped in and gotten involved. So why is this still happening? The FTC called this out in their 2024 PBM report. That was 2 years ago. We know that several states have moved to ban spread pricing in Medicaid contracts, but the commercial employer market is still wide open, which means if you're self-funded on a traditional PBM contract and nobody has specifically negotiated against this, you're probably in it. And the reason why some brokers don't flag it is because they're frequently compensated by the same PBM that they're recommending. The incentive structure does not reward transparency. So transparency often doesn't happen. You don't fix spread pricing by asking nicely. You fix it by changing the contract structure entirely. What you want is a pass-through PBM contract. So a flat disclosed admin fee, the PBM earns a fixed amount for their service, not a cut of every drug transaction. What the pharmacy gets paid is what you get charged. No spread, no black box. 100% of rebates go through to you. Pharmacy doesn't keep any of them. And then full audit rights on ingredient costs. You can verify what the pharmacy was actually paid. The last one matters more than people realize. Audit rights with no ability to actually use them are just decorative. You want a contract that specifies the mechanism, not just the permission. Okay, here's your call to action. Question to ask your broker or your TPA today. Does our PBM contract include audit rights on ingredient costs and spread? I would strongly recommend that every single employer, no matter where you stand, really goes through and does a complete audit on their benefit plan this year. I think it's absolutely necessary. Okay, next week we're talking about rebates.